Hey there, welcome back to the channel. And if you're new here, I'm Dr. William Lee. And on this channel, we talk about health, longevity, and how to optimize your life at any age. Now, if you're watching this video, there's a really good chance that you or someone you love is taking vitamin D supplements right now. And I'm going to be straight with you today because this is important. You're probably taking it wrong. And I'm not saying that to be dramatic. I'm saying that because I see it every single day in my practice, and the consequences of doing this incorrectly can be pretty significant, especially if you're over 50. So stick with me for the next few minutes because I'm going to reveal exactly what you need to know about vitamin D, why most people get it wrong, and most importantly, I'm going to show you the exact protocol that will actually work for your body. This isn't going to be some generic advice either. We're going to talk about personalization, timing, forms of vitamin D, dosages, and how to know if what you're doing is actually working. Let's dive in. All right, so let me start by asking you a question. When was the last time someone told you exactly how to take your vitamin D? Not just that you should take it, but actually how, when, and in what form. Most people, and I mean the vast majority, just grab whatever bottle is on the shelf at their local pharmacy or health store. They read the label that says something like, take 1 capsule daily, and they do exactly that. Maybe they take it with breakfast. Maybe they take it with dinner. Maybe they take it at random times. And they think they're doing everything right because they're taking the supplement, right? But here's the thing, and this is where most people get it wrong. Vitamin D is not one of those supplements where you can just take it however you want and expect results. It's far more nuanced than that. Let me explain what I'm seeing in my practice and what the research is actually showing us. When I have seniors come in and I test their vitamin D levels, I'm constantly surprised by how many people have low vitamin D despite taking supplements. And when I dig deeper and ask them about their routine, I find pattern after pattern of mistakes. Some of them are taking vitamin D at the wrong time of day. Others are taking the wrong form entirely. Many are not taking it with the right foods or nutrients, and a significant number aren't taking anywhere near the amount they actually need based on their individual situation and their baseline levels. So today I want to break this down for you in a way that actually makes sense and gives you actionable information you can use right now. Let's start with the fundamentals because understanding why vitamin D matters is the foundation for understanding how to take it correctly. Your bones, your immune system, your mood, your cognitive function, all of these depend on adequate vitamin D. And as we age, this becomes even more critical. When you're in your 60s, 70s, 80s, your body's ability to produce vitamin D from sun exposure decreases significantly. You're spending less time outside. Your skin is less efficient at converting UVB rays into vitamin D. And if you live somewhere with limited sun exposure during winter months, you're basically guaranteed to have insufficient vitamin D unless you're supplementing properly. Now, the standard recommendation from many health organizations is that seniors need about 600 to 800 international units or IUs of vitamin D daily. But here's where I need to be honest with you. That number is often too low for optimal health. The research that I've reviewed and the work that many functional medicine practitioners are doing suggests that most seniors actually need somewhere between 500 and 4,000 IUs daily, and that's just a baseline. Some people need even more. It depends on where you live, your baseline levels, your age, your skin tone, and several other factors. So the first mistake most people make is they're not taking enough. But it's not just about the amount, it's about the form. And this is crucial. Vitamin D comes in two main forms, D2 and D3. D2 is ergocalciferol and D3 is cholecalciferol. And here's the thing that really matters. D3 is significantly more bioavailable and effective than D2. D3 is what your body produces when you're exposed to sunlight. It's what's found naturally in animal products like fatty fish, egg yolks, and fortified dairy. D2, on the other hand, is primarily found in plant-based sources and fortified foods, and it's also the form that's commonly prescribed by doctors because it's cheaper. But if you care about actual results, you want D3. The research is clear on this. D3 raises your vitamin D levels more effectively and maintains those levels better over time. Now, when you're choosing your D3 supplement, you also need to pay attention to what form it comes in. Are you taking it as a capsule, a tablet, a liquid, a spray, or gummies? This matters more than you might think. Liquid forms and softgels are generally more bioavailable because they're easier for your digestive system to absorb. If you take a hard tablet, it takes longer to dissolve and your body might not absorb the entire dose. Gummies can work, but many commercial gummies have added sugars and fillers that you don't need. So my recommendation is usually liquid D3 or a Softgel capsule, ideally with higher potency, so you're not taking a huge number of pills every day. Here's something else that's critical, and most people never think about this. You need to take your vitamin D with fat. Vitamin D is fat-soluble, which means your body needs dietary fat to absorb it properly. If you take your vitamin D capsule or liquid with a glass of water and nothing else, you're not going to absorb it as efficiently as you could. But if you take it with a meal that contains healthy fats, olive oil, avocado, nuts, fatty fish, eggs, your absorption goes up significantly. This is why timing matters. Taking your vitamin D with your largest meal of the day, which typically contains the most fat, is generally the best approach. For most people, that's lunch or dinner. Let me tell you what I recommend to my patients, and this is based on both the research and what I see working in real practice. First, get a baseline test. Before you even think about what dose you need to know where you're starting from. A simple blood test that measures your 25-hydroxyvitamin D level will tell you exactly what your status is. The optimal range is generally considered to be between 30 and 100 nanograms per milliliter. Some experts, myself included, prefer to see levels in the 40 to 60 range for optimal health and disease prevention. So step one is always testing. Once you know your baseline, then you can determine your dose. Here's a rough guideline that I use. If your level is below 20 nanograms per milliliter, which is considered deficient, you typically need more aggressive supplementation, somewhere in the range of 4,000 to 5,000 IUs daily, and you should retest after 8 to 12 weeks. If your level is between 20 and 30, which is considered insufficient, you probably need around 2,000 to 3,000 IUs daily. If you're already in the optimal range, you need a maintenance dose, which is typically 1,000 to 2,000 IUs daily, depending on your individual factors. And here's the key. Everyone is different. Your genetics, your skin tone, your geographic location, your age, your body composition, all of these influence how much vitamin D you need. Now, there's another critical piece of this puzzle that most people completely ignore, and it's actually kind of shocking because it directly affects whether your vitamin D supplementation works or not. I'm talking about cofactors. Vitamin D doesn't work in isolation. Your body needs other nutrients present for vitamin D to be absorbed and utilized effectively. The main ones are calcium, magnesium, and vitamin K2. If you're deficient in any of these, taking vitamin D alone isn't going to give you the results you're hoping for. Let me explain this more clearly because it's really important. Vitamin D helps your body absorb calcium from your food and your supplements, but then you need magnesium and vitamin K2 for calcium to be properly utilized and deposited in your bones where you need it. Without these cofactors, you can end up with a situation where you have adequate vitamin D in your blood, but the calcium is going to the wrong places, calcifying your arteries, your joints, your soft tissues instead of your bones. That's not what we want. So when you're supplementing with vitamin D, you should also be making sure you're getting adequate calcium, magnesium, and K2. Now, calcium you can get from dietary sources like dairy, leafy greens, sardines with bones, or supplements. Most seniors need about 1,000 to 1,200 milligrams daily. Magnesium is another one. Most people don't get enough magnesium from their diet. The recommended amount is about 310 to 420 milligrams daily, depending on your age and sex. You can get it from nuts, seeds, leafy greens, whole grains, but many people benefit from a supplement. And vitamin K2, which is different from vitamin K1, is found primarily in fermented foods, some cheeses, egg yolks, and grass-fed butter. This one is harder to get from diet alone. So many people benefit from supplementing, especially if they're taking vitamin D3 in higher amounts. So here's what a proper vitamin D protocol might look like for a typical senior. Let's say you've had your baseline test and you're in the insufficient range. You start with 2,500 to 3,000 IUs of vitamin D3 daily in liquid or Softgel form. You take it with your largest meal of the day, the one with the most fat. You pair it with a calcium source, whether that's dietary or supplemental. You make sure you're getting adequate magnesium, either from food or a supplement. And if you're not eating fermented foods or grass-fed dairy regularly, you add in a vitamin K2 supplement. Then, after about 3 months, you get retested to see where your levels are. If you've reached your target range, you can dial back to a maintenance dose. If you're still low, you increase the dose and retest again in another 2 to 3 months. This might sound complicated, but it's actually quite straightforward once you get the hang of it. And the benefit is that you're not just guessing anymore. You're using data to guide your supplementation, which means you're actually going to get results. Now, let me address some of the other common mistakes I see, because there are several. One big one is seasonality. A lot of people, especially in northern climates, think they can take vitamin D supplements during winter and then skip them during summer when the sun is stronger. But here's the thing, consistency matters. Your body needs consistent vitamin D levels year-round. Yes, you might produce more from sun exposure in summer, but you probably still need some supplementation even then, especially as you age. And taking it inconsistently means your levels are going to be all over the place, which isn't optimal. So the better approach is to take your vitamin D consistently every single day, all year long. Adjust the dose based on season if you want, but consistency is key. Another mistake is not accounting for medications. Several common medications interfere with vitamin D absorption or metabolism. Corticosteroids, which are used for inflammation and autoimmune conditions, actually reduce vitamin D absorption. Certain anticonvulsants can interfere with vitamin D metabolism. If you're on any long-term medications, it's worth discussing with your doctor whether those might affect your vitamin D needs. You might need a higher dose to compensate. Here's another one that's really important. Not checking your sun exposure. I'm not saying you should ignore sun safety. Absolutely not. But there's a balance. If you're someone who spends significant time outdoors during peak sun hours, you might be producing more vitamin D than you think. That doesn't mean you shouldn't supplement, but it might mean you need less than someone who's indoors most of the time. So consider your actual lifestyle and outdoor exposure when determining your dose. If you're someone who's outside for an hour most days during warm months, you might need less supplementation during those months than someone who's mostly indoors. Let me also talk about the timing of when you should retest. I mentioned earlier testing after 8 to 12 weeks, but let me be more specific about this. When you first start a vitamin D supplementation protocol, your levels respond relatively quickly. After 6 to 8 weeks of consistent supplementation, you're going to see measurable changes. That's why I recommend initial retesting at that interval. Once you establish your baseline and find the dose that works for you, you can retest less frequently. I usually recommend annual testing once you're stable, just to make sure your levels are staying where you want them and that you don't need to adjust your dose. Now, here's something that's really important, and I want you to really hear this. Megadosing is not the answer. I sometimes see people who decide they're going to take really high doses of vitamin D, like 10,000 or 20,000 IUs daily, without any testing or medical supervision. That's not a good strategy. While vitamin D is generally quite safe, it is possible to take too much. Vitamin D toxicity is rare, but it can happen, especially with very high doses over extended periods. The upper limit that's generally considered safe is about 4,000 IUs daily for most adults without medical supervision. If you want to take more than that, you should be doing so under the guidance of a healthcare provider who's monitoring your levels. Let me give you a specific example from my practice because I think this really illustrates the importance of getting this right. I had a patient, let's call her Margaret, who came to me complaining of fatigue, muscle weakness, and bone pain. She was in her late 60s, and she had been told by her doctor that she should take vitamin D. So she was taking one of those store-brand vitamin D3 supplements, 1,000 IUs daily. That's the difference between just taking a supplement and actually doing it correctly. It's not just about swallowing a pill. It's about understanding your baseline, choosing the right form and dose, ensuring you have the cofactors present, timing it correctly with food, and then following up with retesting to make sure it's working. Let me also talk about age-specific considerations, because vitamin D needs can vary depending on your age. If you're between 50 and 70 years old, you're at increased risk for bone loss and deficiency. If you're over 70, your risk is even higher and you might benefit from slightly higher supplementation. Additionally, if you have conditions like osteoporosis, malabsorption issues, or chronic kidney disease, your vitamin D needs might be different. In these cases, you really do need to work with a healthcare provider to figure out the right protocol for you. I also want to address something about sources because quality matters. When you're buying a vitamin D supplement, you want to make sure it's from a reputable manufacturer. Look for products that have been third-party tested by organizations like NSF International or USP, which verify that the product contains what it says it contains and that there are no contaminants. This is especially important for supplements because the supplement industry is less regulated than the pharmaceutical industry, and there are some products out there that don't contain what they claim. Now, let me talk about the different forms one more time because I realize I touched on it earlier but didn't go into as much detail as I should have. When you look at vitamin D3 supplements, you'll see them come in various delivery mechanisms. There are capsules, tablets, softgels, liquids, sprays, and gummies. From a bioavailability standpoint, the liquid forms and softgels are typically superior because they're already in a more readily absorbed form. If you have difficulty swallowing pills, the liquid is a great option. Some people find the spray form convenient because you just spray it in your mouth, though absorption can be variable. Gummies are popular, especially among people who don't like swallowing pills, but as I mentioned, watch out for added sugars and make sure you're not overdosing because they go down so easily. A tablet form is fine, but it takes longer to dissolve and absorb compared to other forms. One more thing I want to emphasize is the importance of keeping track. Once you start your vitamin D protocol, write down the dose you're taking, the form, when you're taking it, and what you're taking it with. This might sound excessive, but when you go for your retest and your doctor asks what you've been doing, you'll have actual data to reference. Plus, if you need to make adjustments, you'll know exactly what you changed and when. Some of my patients use a simple calendar to check off days they've taken their vitamin D. Others use a phone reminder that pops up every day at lunchtime. Find whatever system works for you to ensure consistency. But again, this is rare with the doses we're talking about. Here's something else that's important. Not all supplements are created equal. An interaction with other supplements or medications can matter. If you're taking calcium supplements in addition to vitamin D, they should be taken a few hours apart because they can interfere with each other's absorption. If you're on certain medications like corticosteroids or anticonvulsants, your doctor should know you're taking vitamin D because your needs might be higher. If you're taking medications for heart conditions, particularly those that are sensitive to calcium levels, your doctor should be monitoring your vitamin D and calcium levels. These are conversations worth having with whoever's managing your health care. Let me give you the protocol one more time in a clear, actionable way so you can implement it starting today. First, schedule a blood test to measure your 25-hydroxyvitamin D level. This is an inexpensive test that most labs can do, and it's worth getting if you haven't been tested in the past year. Second, based on your results, determine your starting dose. If you're deficient below 20, aim for 3,000 to 4,000 IUs daily. If you're insufficient, between 20 and 30, aim for 2,000 to 3,000 IUs daily. If you're already in the optimal range, 1,000 to 2,000 IUs daily for maintenance. Third, choose D3 in either liquid or softgel form. Fourth, take it with your largest meal of the day, the one with the most fat. Fifth, make sure you're also getting adequate calcium, magnesium, and K2 from food or supplements. Sixth, retest after 8 to 12 weeks. Seventh, once you reach your target level, adjust to a maintenance dose and retest annually. It's also worth thinking about your individual risk factors for low vitamin D. Are you in a part of the country with limited winter sun? Do you spend most of your time indoors? Do you have darker skin, which naturally produces less vitamin D? Do you have any malabsorption issues? Are you on medications that interfere with vitamin D absorption? If you answered yes to any of these, you're probably on the higher end of the dosing range I've mentioned. I also want to talk about the big picture of why this matters. Vitamin D isn't just about bones, though bone health is certainly important. Adequate vitamin D levels are associated with better immune function, better mood and mental health, better cardiovascular health, better blood sugar control, and even better cancer prevention. When you optimize your vitamin D levels, you're not just fixing one thing. You're supporting multiple systems in your body. That's why getting this right is so important. As you're implementing this, be patient with the process. Vitamin D levels don't change overnight. It takes several weeks of consistent supplementation to see significant changes in your blood levels, and it can take several more weeks for you to feel the effects in terms of improved energy, better mood, stronger bones, and better muscle function. but if you stick with the protocol, you will get results. I also want to encourage you to share this information with your friends and family, especially if they're older adults. So many people are taking vitamin D incorrectly and getting suboptimal results without even realizing it. By sharing what you've learned here, you might help someone avoid the fatigue, muscle weakness, and bone problems that come with deficiency. If you have specific questions about your situation, whether you should supplement or what dose might be right for you, definitely talk to your healthcare provider. They can look at your individual circumstances, your medical history, your medications, and your test results and give you personalized guidance. But armed with the information you have now, you can have a much more informed conversation with them. So let me recap the key points one final time. Most seniors are taking vitamin D incorrectly, either in the wrong form, in the wrong amount, without the right cofactors, or without checking whether it's actually working. Vitamin D3 is superior to D2. You need to take it with fat-containing foods for optimal absorption. You need the cofactors, calcium, magnesium, and K2 for vitamin D to work properly. Testing is essential to know your baseline and to verify that your supplementation is working. And consistency is key. Taking it randomly or inconsistently won't give you the results you're after. Getting your vitamin D right is one of the most important and often overlooked pieces of the health optimization puzzle for seniors. It's foundational. When your vitamin D levels are optimal, everything else is easier. Your immune system functions better, your mood is better, your energy is better, your bones are stronger, your muscles are stronger. It's one of those interventions that's relatively simple, relatively inexpensive, and has a significant positive impact on your health and quality of life. Thank you so much for watching this video. If you found this information helpful, I'd really appreciate it if you'd like the video and subscribe to the channel. I put out content like this regularly, focused on helping you optimize your health and longevity at any age. Leave a comment down below and let me know if you have questions about vitamin D or if there are other health topics you'd like me to cover. Thanks again for being here, and I'll see you in the next video.